Over 70% of private GP clinics in Malaysia are struggling to stay afloat. At the same time, public clinics and hospitals are overcrowded. Both of these things are happening together. How? Malaysia actually runs a dual healthcare system. Public healthcare is heavily subsidized, and private healthcare is mostly paid out of pocket or insurance. And that creates a gap. A visit to a public clinic can cost as little as RM1, and a private GP visit can cost RM30 to RM80 or more. That price gap shapes behavior. Most everyday illnesses like fever, cough, minor infections can be treated at GP clinics, but demand doesn't spread evenly. It concentrates because public clinics handle high patient volumes every day, and public hospitals absorb the overflow. Private GP clinics, however, are built to handle these same cases and actually see fewer patients than expected. Not because people don't need care, but because of where they choose to go. Because the price difference makes them want to go public instead. What aggravates the situation is that the costs of GP clinics keep rising. Rent increases, staff costs increase, and regulatory requirements too. But the patient volume isn't increasing, and that's why a large share of clinics right now are financially strained. So some of them reduce hours or reduce hiring, but some of them eventually shut down. Other countries manage this quite differently. In the UK's National Health Service, GPs are the first point of contact, and hospitals are not the default entry point. In Singapore, government subsidies extend to private clinics, so patient loads are shared between public and private. They don't over-rely on hospitals to absorb everything. Malaysia has enough clinics, but most patients are not using them. And if these clinics are shut down, we just have fewer places to go. So more people end up in the same clinics and the same hospitals, waiting longer for everything.